The outreach initiative targeted areas severely affected by flooding, where access to healthcare services had been compromised. These areas often face increased risks of waterborne diseases, injuries, and mental health issues arising from the trauma of the disaster. By venturing into these communities, the International Needs Ghana and International Needs Canada demonstrated a commitment to reaching the most vulnerable populations. The team lead of the health unit, Prosperous Ahiabli, has been speaking on the medical outreach in the affected communities.
We've been to a number of areas across the central Tone and the North Tone districts of the Volta region. We have reached a total of about 1,100 in our medical outreaches, and so by the end of today, we would have reached about 1,250.
The medical outreach was comprehensive, offering a range of healthcare services to address the diverse needs of the affected residents. Services included basic medical checkups. The trained medical professionals conducted thorough checkups to identify and address immediate health concerns. Dr. Theodore Megashi is a medical doctor with the International Needs Ghana.
This year, our outreach is centered around the Central and North Tong districts. We are on a 2-week medical outreach. We started on the 14th of this month. We've been to a number of communities, and this is our last community that we are attending to. Over the period, we've seen different number of medical conditions. But then the most alarming are the increasing cases of bilharzia or schistosomiasis, which is a waterborne infection as a result of intake of contaminated water by the indigents. We've been seeing a number of cases over the years, for some of which we have instituted interventions as such as improved water sources for the different communities. But then this time, we've seen that the incidence has gone up a little higher than we usually see. So that has that alarmed us a bit. But then another problem with the schistosomiasis infection is that we've been having challenges procuring the medication that we use to treat it, which is the praziquantel. We've been trying to get these medications for several years now, and it's becoming a challenge, and it's quite expensive. We would appeal to the Ministry of Health and other health authorities that if it's possible, they can fast track or go into any partnerships that can improve or even enhance local production of these life-saving medications, or these medications that can help eradicate these conditions. It will be very helpful.
Dr. Rebecca Kusembrick is the team lead for the International Needs Canada.
There have been extreme cases like children who have had their insulin spoil because of lack of refrigeration. And when the insulin spoils, the child goes into a diabetic crisis, something called DKA. And we've met a couple of children in extreme distress because of that and have had to send them to hospital. Like the burden of some of the more acute infectious diseases has been similar. But the results of displacement and then cut off supply to medication renewals, we have seen that, yes. The other thing, honestly, that we saw, that the diabetes that I was saying, children with diabetes need insulin. And we struggle like crazy in Canada, where there are dedicated clinics with pediatricians, social workers, nurses, educators, dietitians, everything to manage children with diabetes. And I see a 12-year-old here who is in a diabetic crisis. And she has none of those supports. It is a complicated illness to manage. And I think it's probably one of the things that I've been most struck by this particular visit.
Ivy Satoji, Joy News, Bato.